we're going to go through a closed kinetic chain upper extremity test. So again, this is a test which again is in weight bearing. Again, it's going to test Lockie in this scenario, Lockie's ability to sort of his muscle capacity and his endurance, and also neuromuscular control of his arm. Okay, so you'll see through the test, he'll be transitioning left to right. And so we want to assess his ability to sort of move quickly, but then also his ability to sort of, I guess, stabilize as he's shifting his weight from one limb to the other. Okay, so what we're going to come over here. So we've got this marked out. So Lockie, I'll get you positioned just here. Okay, so the way we've set this up, we've got tape either side here. So that distance is about 36 inches or 91.4 centimeters respectively. Okay, what we're going to do, Lockie's going to be in a push-up position here. Okay, and then what we're going to do, we're going to ask Lockie, now you're going to do this as quickly as you can for 15 seconds duration. You're going to start from here, you're going to tap your hand past that tape. In fact, just move your hands a bit wider. So what I tend to instruct my patients is having the sort of middle of the pinky and the middle of the index finger, that sort of webbing in there in line with that tape. Okay, now what Lockie's going to do, he's going to reach and alternatively tap left to right as many times as he can in 15 seconds. Okay, do you understand that? Yep. All right, so I'm going to time this. Okay. Okay, in push-up position, Lockie. So ready, set, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, that's 15 seconds. So achieve 12 taps there. That's a really low score. So Lockie's just gone through that, hopefully, as a bit of a warm-up to get a bit of an understanding of the test. So what he's going to do now is to do that as quickly as possible, okay? And what we're going to do here, he's going to try and transition very, very quickly as fast as he can. We're going to be counting those reps and those taps each side. At the same time, we're going to be very vigilant and making sure that his hand doesn't fall short of that tape. If it does fall short of that tape, we don't count that tap. Does that make sense? All right. Let's get in position here. All right, so you're going to move pretty quickly here, Lockie. Okay. So 3, 2, 1, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Good. Much better than 12. Okay. What we tend to do, we do this 3 times. Between each 15-second trial, there's about a 45-second period of rest, and then we go through a subsequent trial. Okay. Lockie's just busted out 20, did 12 at the start. We're going to time in for 45 seconds, which for time, let's say that is right now. Lockie, same position again. Let's try and beat that score as before. Okay, so 3, 2, 1, go. 1, 2, 3, 4, 5, 6, 7, 9, 10, 14, 15, 16, 17, 18, 19, 20, 1, 22. Good, and stop there. So 20 and 22 reps respectively. So we come over here. Lockie's done for the day. He's gone through this battery test. Good work, Lockie. All right, so when we're looking to interpret these scores of the CKC UES, what we're looking for here, you can do this a couple of ways. You can look at the peak number of touches. So again, which trial resulted in the most amount of touches. What you can do and what's been, I guess, reported with good reliability in the literature by Rogowski and colleagues was that taking the average number of touches for the last 2 trials. So for in that case, Lockie did 20 and 22, which meant that he got about 21, which was his average. So we would report that score. We'd also then do a normalized score, which is, this can get a bit complicated. So number of touches divided by the patient height. So again, we're taking Lockie's height at 100 centimeters. Again, giving a bit of a normalized score based upon his height and his arm reach. And then lastly, we can also do what's called a power score. And basically, in short, what a power score is the amount of work that Lockie is producing per unit of time. And the way we determine that is the number of touches is achieved. So let's go 21 times by 0.68. You might remember back when we're doing the push-up test, was that in a push-up position corresponds to about 68% of the person's total body weight on the upper limb during that push-up position. So number of touches times 68% of his body weight. So again, it would be number of touches times 68 and then divided by 15, which obviously corresponds with 15 seconds of that test, which we then get a power score. Usually what we see in the literature that's been reported for people, for people who are healthy and those who are following surgery, a rough power score for a control group is about 90 to 95 usually. For those who have had, who are post, 6 months to 12 months post stabilisation surgery, irrespective if it's Bankart or Latarjet, usually about 78 of that power score. And again, the average number of touches that we tend to see post stabilisation is in around 21 to 22 touches and 25 touches for those who are in control group. There are some other norms which have been produced, which look at more collegiate level athletes, both male and female. So if collegiate level, they're probably early 20s, which Lockie fits in that demographic. If you look at some studies, depending on what you read, you might see some normative scores around 22, 23, 24 reps in total. Okay, so they're the tests, and like I said at the start, there are many more tests to do. So I guess one battery test we haven't really covered today is the SARTS test, which is the battery test that Margie Olds has put together, which I'll include in this resource. They're very, very good. They're reliable. They've been validated, and certainly appropriate for people who are post stabilisation surgery, post injury as well, or general shoulder injury and other surgeries as well.